Chapter 1, Video 1. Today we're going to talk about working in the advanced care setting. The first thing that you guys need to know and understand is we have different types of facilities. And the first type of facility that we're going to talk about is the acute care facility. The acute care facility versus the long-term care facilities, and the different types of facilities. But we're going to first start with the acute care facilities. Acute means sudden onset, okay? It happens rapidly. So if you get sick or ill, you go to the hospital, and there is where you will receive a high level of nursing care. And then you have your subacute care centers, such as your skilled nursing units, your rehab facilities, your acute care unit in a long-term care facility, and a person's home. These can be types of acute care facilities as well. The med-surg unit in the hospital, labor and delivery, the rehabilitation unit, the psychiatric unit, the dialysis unit, and the operating room. So these are acute care facilities. So please know the difference in the acute care facilities and what they are. Which of the following does not offer acute care? So here's a good question. So we just went over looking at the slide. What the different acute care facilities was. So looking at this question, which of the following does not offer the acute care? The answer here would be hospice, okay? Hospice care offers end-of-life care only. They are focused on keeping the person comfortable. So know your different types of facilities and what they do, because that is important. So you'll need to read your chapter and research through that. And if you come across questions when you're reading your chapter and studying your chapter, please don't hesitate. Reach out to me. I'm a resource. I'm here to help you. I'm just recording these lectures so you guys will have them at your fingertips. And you can go back to them at any point in time. Now we're going to talk about the examples of patients. An acutely ill person who has a severe illness or is unstable, this would be like a person with a stroke who just had a CVA, a stroke, and a CVA stands for cerebral vascular accident, just so you know that as part of your medical terminology. CVA is a cerebral vascular accident, so please plant that to memory because you will see that term used often. And then again, an acutely ill person is going to be a person who just had a heart attack. Remember, we said an MI is a myocardial infarction, and that is considered a heart attack. A person that has one or more chronic conditions whose treatment is complicated. So this would be people with diabetes, congestive heart failure, HIV, and pneumonia. So this is another type of a patient. We have an acutely ill person, and then we have a chronically ill person. They have multiple comorbidities when they're chronically ill. They have a problem that's not going away. Once a person is a diabetic, they're always a diabetic. You can do things to improve your health condition. You can do things to lower your blood sugar, but that diagnosis and that problem is going to always be there. So you have to figure out how to treat it and how to handle it in the long run. Advanced care, we can receive care in the advanced acute care setting as well. And the advanced acute care setting can be provided in other settings like nursing home and rehab facilities. But the most important set of factors that could put a patient in need of advanced acute care is the patient having one or more chronic condition. So earlier discharge from a patient in the hospital and close observation and a high level of nursing care are required for patients with unstable conditions. So what we're saying here is if a patient has chronic conditions such as diabetes, such as heart failure, then this increases the chance of them having to go to the hospital or go to a facility because they're having an acute condition. They're having something going on that's related to that chronic condition that requires them to receive that acute care. And if you need clarification on that, again, please see me. If you have questions, let me know. Now we're going to talk about holistic and humanistic care. Holistic, humanistic care is described best by considering the patient's emotional, social, and spiritual needs as well as their physical needs. So, holistic and humanistic care involves acting with empathy and compassion, having respect for the person. We have to consider the person as a whole. We consider their emotional needs, their spiritual needs, and their physical needs. Each person is treated uniquely here. These high-tech environments that we work with our computers, with the equipment that we use being so advanced, the healthcare persons tend to get so wrapped up and so focused on what's going on with the equipment and what we have to take care of with the equipment that we tend to forget that this person is human. We need to treat them as a whole. We need to provide compassion and empathy. We need to talk to this patient. We need to remember that we need to forget that machine long enough to let the patient know that we are there and we do care for them and we are there to meet their needs. An example of humanistic care would include monitoring visits to allow the patient adequate rest. That is an example of humanistic care. Humanistic care, just say we have a patient who recently experienced a myocardial infarction. The doc went in, they put a stent in, and the patient's heart has been irritated from where they had the cath and where they've had the stent. And every time they see somebody or they see a family member, they become anxious and their heart starts racing. So humanistic care would be like, okay, I'm going to have you guys go sit out here so the patient can rest. Not going to let you all in the room at one point in time. We're going to kind of space this out because, you know, the patient's getting really excited and it's to the best interest that we keep his heart rate or her heart rate at this level. And when people come in the room, it's going above that. So limiting the amount of people to allow for rest and to allow the body to heal from whatever condition they may be suffering from. That is an example of humanistic care. We need to always, again, remember that it is very important for us to treat each human being as an individual. We need to allow this patient privacy. We need to knock on the door before we enter. We need to call the patient by their preferred name. If their patient is, her name is Elizabeth and she goes by Beth and she wants to be called Beth, then we need to call her Beth. So we need to respect the patient's wishes. We need to listen to the patient. When we talk about listening to the patient, one thing that I want to point out to you, if the patient is talking to you and you have your back turned and you're working with medications that you're going to give the patient, turn around and look at that patient eye to eye when they're talking to you. Acknowledge that patient. Be that active listener. Let them know, I am interested in what you are saying. And if you are pulling medicines and you know you're crunched for time and you're working while you're talking, take a minute just to say, okay, honey, I'm getting everything together, but I'm listening to you. I don't want you to think that I'm ignoring you. So make sure that the patient knows that you are into what they're telling you. Make sure that you look interested in that patient, because if you don't, they pick up on this. Take time to get to know the patient. Figure out what the patient likes and what they don't like. Ask the patient before you just walk in and grab their hand. Stick your hand down and say, Mr. Jones, do you mind if I hold your hand for a second and take a peek at your IV? I'm fixing to touch you on your arm to look at this IV or to look at this wound that you may have. Are you okay with that? You know, let them know that you are there for them and you respect their wishes. Making sure that we maintain privacy in all care. We don't want to be talking with the patient about their health condition and the room door be wide open where everybody down the hallway can hear. So, you know, privacy is huge. All patient information is confidential. And again, it's protected under HIPAA, the Health Insurance Portability Act. So please be familiar with HIPAA. There's different things that affect the healthcare delivery. Increasing cost of healthcare. The increased cost of healthcare and the lack of unlicensed nurses leads to advanced skills and training being placed on nursing assistants. We talked about cross-training in one of the other lectures. I'm not sure that all of you were in that class, but cross-training is teaching employees how to do skills that are usually not in their scope of practice. So they, because of the demands placed on healthcare and because of, lack of resources, we have been forced to cross-train individuals. So you're going to see a higher level of care placed on people who you may feel not be adequately prepared to do the job or whatever, but we have to really work closely with them and make sure they understand and know what they're doing when we're cross-training these individuals. The nursing assistant, the patient care tech, they may be receptive to additional training beyond their basic. They may be receptive, they may not be. So we just want to make sure they're comfortable. We want to make sure that we're providing that quality care to the patient. Which of the following is a factor that has contributed to the change of health care? One of the big factors that we just talked about as far as cross-training is concerned would be the shortage of nurses. The answer here would be the shortage of nurses. So this places more skills on that nurse tech, on that patient care tech. They're getting a higher level of care because of the shortage that we have. Cross-training employees how to do skills that are not usually within their scope of practice. That is what cross-training means. So an example would be, we're teaching this nursing assistant how to collect blood. But one thing that's important to remember when we're talking about cross-training, federal regulations protect the public health care worker by establishing regulations that ensure health care workers are properly trained and competent. And this is where we're going to stop today with Chapter 1, Video 1. But if you have any further questions, please let me know.